to say, she does look great. Well, speaking of her, she is famous, of course, for all the work that she's had done to her face. Today, though, we're going to talk about a new cosmetic treatment, but this is for the body, not the face. It's also said to be safer than traditional liposuction.
And it's called VASER Lipo, and it removes fat from the thighs, hips, arms, love handles, and yes, even the butt.
The buttocks.
Where we all want it removed from. So here with us now to talk more about the VASER Lipo are doctors Emil Hurst and Jim Walker. And they're with the Milwaukee Vein and Laser Center. So welcome to the Morning Blind, guys.
Thank you.
Nice to have you.
Yeah, thanks for being here. So VASER Lipo, I think this is something that not everybody's heard about. What is it?
Well, VASER Lipo is a novel way to gently and selectively remove fat using a special ultrasound wand. And I think we do have a quick video segment here of this being used on.
And this kind of demonstrates the process, right? Because like we said in the beginning, it's different than traditional liposuction. Can you explain now as we look at this how it's different?
Well, here you can see this special ultrasound wand being inserted into a beaker of Crisco, and it's gently breaking apart the fat, selectively breaking apart the fat, and gentle enough that you can see somebody can touch the probe without entering the skin. So that shows the selectivity.
Okay, and it shows how gentle it is too,
Correct.
right?
Yeah, absolutely. The main difference, traditional liposuction uses a powered mechanism to break up the fat, whereas VASER actually uses ultrasound energy to liquefy the fat so it can be gently removed, so you don't have those very large probes and high-powered suction. We use very low-powered suction. It's very gentle.
Okay.
So are you actually going into the skin? Is there scarring then, or how does that, or does it go over your skin?
Because it's a gentle way of breaking up the fat using this tiny ultrasound wand, there are actually micro-incisions, and very few of these micro-incisions, about 1/4 of an inch in size, are required even to treat large areas.
Because a lot of people who've had traditional liposuction, especially if it was many years ago, will talk about scars that they still have from the procedure.
Yeah, absolutely. Everything is just much smaller and much less invasive these days.
What about people who wonder if VASER Lipo is a good way to lose weight? What do you say to that?
Well, really in conjunction with the what everybody knows about diet and exercise, but you should think of the liposuction, VASER liposuction, as a way to recontour a bulge, like you said, the love handles or the abdomen. To recontour those parts of the body.
I have no clue what you're talking about. I have no bulges, right? Right, women? No. We all have the bulges. We all want to get rid of them. And I think we've all heard of different body shaping procedures before, whether it's injections or it's lasers. How is this different then? And how is it going to be maybe easier, or can you go back to work right away?
A couple of questions there. Number one, there are several other techniques. There are lasers that can go underneath the skin and burn the fat that tend to be a little bit less effective and not as selective for fat. There are lasers that work actually without violating the skin with any kind of device, but those can only penetrate a ½ inch or less of fat. Injections are injections of various substances. There are no good studies that show that these actually work, and you can't see results with those right away.
Well, and when we looked at that, the Crisco that was in that vial, it looked like so much. It looked like a large mass of fat, and I know it was a simulation of that. It's hard to imagine that small wand could eliminate or suck out that much fat.
Absolutely. It's actually the wand actually liquefies the fat, like you saw in the diagram in the video. But then a very small suction probe actually sucks out the fat afterwards.
Okay, so that's something that kind of attacks the fat, liquefies breaks it down, and then something else suctions it out. Okay, I see.
Exactly.
Okay.
And the wand is small, but the ultrasound energy actually kind of envelops the end of the wand, so the area that's treated is much bigger than the wand itself.
And speaking of the area that's treated, when we were introducing this, we said that it works on love handles. We were talking about the butt, the stomach. Does it work on arms also?
Absolutely, yeah.
Okay.
Well, because it's less invasive, you can use it in areas you might not think of for traditional liposuction, like the neck, the arms, the knee area.
Okay.
And by the way, it's not just for women, men and women. Love handles on men as well. So.
And are these results typical that we're looking at in before and after pictures?
Yeah, absolutely. And what you can see there is there's a difference in the contour, you know. What you can pinch is reduced significantly. So yeah, these are typical results for an abdomen VASER.
And that's incredible.
Yeah, that one
because nobody likes back fat.
No.
Absolutely. Works great on the back as well, yeah.
That's fantastic.
Do you have to go into a hospital to do this then, and is there downtime after?
No, just because of the minimally invasive nature, this procedure is well suited to an office setting. A mild oral sedative taken by mouth can be used just to relax for the procedure, and then the procedure is performed under local anesthetic.
With immediate results, too?
Well, you know, we see great results after several days. It usually takes about 4 weeks to get your final contour result, though.
Okay.
Special event or something you're planning for.
Okay, and this is a demonstration, too, of how it works as well, right?
Yeah, absolutely. What we have here is local anesthesia being placed in the area of interest, and you can see it expands then. And now you've got the energy from the VASER ultrasound probe liquefying the fat. What you can see is the tissues, such as blood vessels and nerves, are preserved there, and those are not affected by the energy of the ultrasound. And now you're going to see, the next thing you're going to see is the actual suction and removal of the liquefied fat.
That's the part I like.
Shrinkage.
That's the key part, right there.
I like it.
And there's your immediate result.
Yeah.
You have an open house coming up. It's actually this Saturday, May 15th, from 9 in the morning until 1 p.m. at the Milwaukee Vein and Laser Center. This is an opportunity for people to meet Tiffany.
Yep,
too,
I'll be there.
You're going to be there from sometime in the morning, and it's a chance for people to come and ask questions, find out more about it.
Absolutely.
Okay, and you're located at 6150 West Layton Avenue. Go on over, say hi to Tiffany.
Yeah, stop by.
In Greenfield. The phone number for more information is 414-761-8346, and MilwaukeeVeinandLaser.com is the web address you can go to for more information. A pleasure to have you guys.
Thank you so much for being
Likewise.
here.
Thank you.
And we'll be back right after this.